Good morning, everyone. Welcome to today's event. Really appreciate you coming today. And today we're going to discuss the Keighley Community Health Grants Fund. It's the second round for round 2021. We'll have a Q&A at the end, but just to let everybody know that this session is being recorded. So if you could please pop your microphone on mute, and if you want to, you can turn off your camera as well. So we'll do some welcome and introductions to start with. I'll start. My name is Helena Bassey. I'm a grants officer here at GiveBradford, and I am the programme lead for this fund. I'm going to introduce my colleagues. I'll start with Susie Finlayson.
Hi everyone, Susie Finlayson from Power to Change.
And Bill Graham as well.
Hi everyone, I think I know quite a few people here today. Bill Graham from the Modality GP Partnership.
Thank you. So I'll go through a bit about what we do as GiveBradford and a community foundation, and then we'll move more into the fund's aims and the application process and the dates and timelines, and the Q&A will be sort of around 20 to 15 minutes near the end of this session. So what do community foundations do? We're part of a national network. There's 46 affiliated community foundations across the UK, and we work across Leeds, Bradford, Wakefield, and sometimes other parts of Yorkshire. And we give out, as a collective, £1 billion in grants have been given out since the foundations began in the UK. Across the network, we have £692 million in endowment, and 98 million were given in grants between the year 2019 to 2020. Again, altogether as a collective, combined, community foundations were the fourth largest UK grant maker. And we all work together, but we also work individually. So as GiveBradford, we work with local businesses, private donors, and sometimes the government or the council, and we work to inspire businesses and private donors to give money locally. So we're really about the community spirit and all of us coming together to support one another. We give out efficiently to high quality community work supporting local people. So we do have an application process for the majority of our funds. And we're here to support groups with that process as well. We work and we have experts in our patch which give an overview of need, and we work as a practical vehicle for action for our communities. So just a bit about GiveBradford. Some of you might have heard of us before, but if not, just very quickly. GiveBradford is a campaign, and it was launched in 2017 to invest in local community activities which create positive change and improve the lives of local people across the Bradford district. Since 2020, we've distributed just over £1,700,000 through 189 grants to charities and community groups across Bradford district. We did also do last year grants through our Resilience Fund to support charities and groups through through the COVID-19 pandemic, and we made just under 440,000 through grants there as well. GiveBradford, we have a 100 Club, and this continues to engage with businesses and individuals who want to make a difference in the area in which we all live and work. And we are working, and we seek to attract further investment to enable us to continue the work that we have been doing to create a city of opportunity in Bradford for all. A bit more information about our current grant making. We are growing as a foundation, but this is just an overview of some of the funds that we do run. We have Bradford Youth Fund, example that works in partnership with Bradford Council for youth activities and youth work. We have Pairs, the Sir Ken and Lady Morrison Fund. We work with the Morrison family with this one. Healthy Holidays is one of our largest funds, and we distribute funds for activities and food provisions for children across the district in the summer holidays and Easter. We also have High Sheriff Fund, tackling crime prevention, and supporting young people. Go Higher and Manjit Woolston Home Fund, they work for young people, again, to increase their aspirations, access to opportunities and training and learning. Community Partnering Fund, and I Will as well. So we are sort of growing our portfolio of grant making, but that's just an overview about other funds that we deliver in the district. So we'll go through why we are here today, which is the Keighley Community Health Grants Fund, round 2021. So if I start just by explaining a little bit more about the fund's aims. It was created through GiveBradford and Power to Change, have come together to create a community-led health offer in Keighley. The aim of the fund is to improve health outcomes for people in Keighley by supporting community groups and community businesses to engage with social prescribing. We're hoping to invest in and develop community-led health solutions and support them to be in a position to be commissioned by mainstream health service in the future. So we really want to see a network of social prescribing across the Keighley area. Social prescribing, it's fairly still new, but it's a way for NHS agencies to refer people to local services which can meet their needs. There are many people who do go to GP surgeries with issues that are social, not necessarily medical. So by giving people time, focusing on what matters to me, and taking a holistic approach to people's health and well-being, social prescribing connects people to community groups and other services for practical and emotional support. This also helps to reduce the pressure as well on local GP surgeries. So to make social prescribing work, we need to support existing community groups to be accessible and also to be sustainable, and help people to start new groups and work collaboratively with local partners and the NHS and GPs. So the main aim of the funds is to develop sustainable projects so that community organisations, you guys, are a core part of Keighley's health infrastructure, and develop community-led health solutions which are or will be ready to be commissioned by the mainstream health services. So this is the second round. We did do the first round last year. For this round, there's approximately 175,000 available in funds. And last year, just to give you a bit more overview, we gave out £157,457 in development grants and 22,000 in Kickstart grants. So just giving you some activity ideas, but we know that you know the communities best and the people that you support. So this is just an example of some of the types of activities that can be funded through the fund. So an example of what we saw from last year, we did social prescribing focused on nature or outdoor activities, gardening, allotments, walks, campfires, that sort of community spirit, and taking part in outdoor activities. We also did peer-to-peer support groups, wellness programs, a wellbeing cafe with skills and learning sessions as well, arts and crafts sessions. You may choose to do organisational capacity building as well. So that could be staff training or recruitment of specialist staff or coordinators. We did recovery and referrals program as well, exercise classes or physical activities, and healthy lifestyle programs. And again, community capacity building and working closely with maybe a volunteer program, befriending support, etc. There is additional support for this fund as well. We're working closely with the Airedale Community Partnership, which includes the Modality GP Super Practice and the WACA Federation, who operate local primary care. This allows grantees to link and connect to their local primary care providers and GP surgeries. One of the main reasons to create this fund is to promote integration of health and community. The involvement of local Keighley GPs shows their commitment to community-based solutions to make Keighley a healthier town to live in. And with this fund as well, the key things to demonstrate in your application or your proposal is two things. How will your activities improve the health and well-being of people in Keighley? And the second is how will this grant support your organisation to engage with local NHS providers? So they're the two key things that we'll be looking for in your proposal for this fund. So I've just spoken a bit about I guess how this fund has come to be. I'm going to hand over to my colleague from Power to Change, Susie, who will talk a little bit more about community businesses and Power to Change's role with this fund as well. Thank you, Susie.
Oh, sorry, thanks, Alina. Hi, everyone. I'm Susie from Power to Change. We are the national body that supports community businesses. One of the things to say up front is you don't have to be a community business to apply for this fund by our definition, but we've put in some of the resource to it, so some of the organisations will be community businesses. So we consider community businesses to be locally rooted. They're organisations that trade, but any surplus they generate is reinvested into local social good. They're locally rooted, so they're really kind of place-based and of that community. And really importantly, they're accountable in some way to the community they support. So that can be anything from really deep community engagement, really being able to articulate how what you do is driven by the strengths and the needs of the people who you work with. And it can be everything up to a formal community share offer where people buy a stake in the business and get a voting right in how it's run. So there are a whole range of different examples. It can be if the local library is closing down and the community don't want it to, so they take it on and they run it as a library, but often they'll do loads of other things out of it. Similarly with pubs, we quite often see that happen. And it can be through to kind of community hubs. We've supported a lobster hatchery, so it can kind of be anything. There's no kind of definition of what business it needs to be. We can jump through slides, Rachel. So community businesses have multiple impacts. They broadly address the social determinants of health, which most of you will be really, really aware of, I'm sure. So they reduce isolation, they bring people together, they create community cohesion, they offer training and development opportunities and a whole load else. Our latest research into them, there's over 11,000 across the country. They employ over 35,000 people. And I think really interesting is £870 million of assets owned by the community business market. And that's one of the things that gives community businesses, those that own assets, they don't all own assets by any means, but those that do, sort of kind of sustainability, because if you've got a physical asset, you can rent out space, you can hire it out, you've got that income generation opportunity through that. I should have mentioned actually, when we say trading, it can be goods or services. So it's not just selling a physical thing. It could be that you've got a contract with the NHS, and it could be multiple different things. And we're not expecting community businesses to be 100% trading. There is a balance of grants and trading and other fundraising income. So there's a whole range of different things. It's not at all expected that you'd be 100% trading. We can jump forward. So yeah, so community businesses impact and contribute to kind of the health system in a few different ways. So they provide this community safety net, and I mean, you'll all be more aware than I am of the impact that community organisations have had during COVID and how they really have provided that kind of safety net for people in their communities. And so, you know, we knew that was the case before, but it's just been really, really highlighted, that importance of community-led organisations and community businesses in providing that kind of safety and local support. They work alongside formal services, they improve outcomes, deliver social prescribing, and some of them are also getting contracts for more kind of service delivery. So that could be mental health support, as some of you already do, or diabetes prevention and things like that. So there's a whole range of different things that community businesses do in the health space. And I think the reason that we were excited to get involved in this fund and are really excited to continue working it is we all know social prescribing works, and so I don't feel like we need to prove that in and of itself social prescribing works. But one of the hopes from this, and hopefully Bill will talk about it a bit more in a minute, is that through this work we can really start to articulate enough of the impact that we can get sustainable funding streams into organisations that are delivering social prescribing activity. And that for us is one of the most exciting things about this bit of work and the opportunities through this, is that, you know, it shouldn't need to be grant funded forever. We should be able to get other sustainable income streams supporting organisations that are responding to this. Okay. So yeah, so I'm going to talk through quickly an example of a community safety net, but I actually don't think, given how everyone's responded in COVID, that we really need to. But this is a community pub in Brighton that did great things, but I know you've all been doing great things as well. So I don't think I need to describe those examples anymore. So we can skip through. Yeah, so I think this is just some of the evidence base that we're building on as an organisation. Is we know that community businesses and community business on the spectrum of community organisations provide social connection. They bring people together. They reduce isolation for people. They improve self-esteem. They deliver training and build people's skills and confidence. They improve mental well-being, and through, a number of you do this as well, through access to kind of nature and physical activity, they can improve people's physical health. So there are a number of ways that community businesses contribute to improving health and well-being. Next one. Yes. So I think I've touched on this, that, you know, community businesses with others, and we know there's a spectrum. We're not saying it's community business or nothing else. It's part of the kind of socially trading and community organisation market. We want to support community organisations, community businesses in Keighley, and we want to build a movement across the area of this kind of strong community-led activity and the engagement with the health service. You know, that's why having people like Bill and the modality group and involved in this is really important. But we also really, from our perspective, we want to generate evidence and insight from this, that we can influence local systems where you are, but also take that, because we think this is really at the forefront of something, take that and influence nationally. So we're really hopeful that this is going to kind of launch in other places in a way that not necessarily relies on grant funding, but that learning from this can really influence how other systems behave and how they support and work with their community organisations locally. Over to Bill.
Hi, hi everyone. Nice to see everyone. Yeah, thanks, Susie. Thanks for that. Obviously, some of you will think you are community businesses, and some of you will think that you're not community businesses, and that's fine, because the fund's kind of organised in a way to be able to support people just who would maybe say they're just doing charitable activities with no element of finance in there, and then obviously for people who are actually trying to build a sort of a, you know, in this day and age, you know, a business that's putting something back into the community, whether it's through a CIC type format or other formats. I know we've got some CICs in the room. You know, it's ideal for that sort of organisation as well to apply into. So really good mix here. And I think that reflects, it kind of reflects what happens in Keighley and what happens around the country. You know, there's lots of different ways for patients to connect with their communities. Lots of different ways for it to happen. And the funding, in effect, is to try and help make that happen better, make those links better. And that's exactly where social prescribing comes in. Now we have, it's one of these things on the Zoom call, because the slides are up, you can't see everyone, but I think we've got 3 of our social prescribers here. We've got, I think Midge is here. She's introduced herself in the chat and she's left an email address if anyone wants to email her. We've got Simon Booth's on the chat, and Louise Rowe is on the chat as well, is in the call today. So we've got at least 3. If there's anyone else there, I'm sorry, I can't see you. I think I missed Louise the first time, and she did point that out to me. So yeah, so we have social prescribers locally, and the 3 on the call today all work with the modality GP practices, which in Keighley is about 65-70% of the population in Keighley and Airedale. But we also have, you know, the WACA, the other practices, which are, it's generally it's North Street and Ling House. They'll also be involved in the work, and their social prescribers will be involved as well. And the idea is to use your social prescribers as your link to being able to hook up with the patients and get patients involved in your projects. So it's really thinking about how we build and develop those links. It's really, I mean, for our patients, it's important. For our social prescribers, it's important they know what's going on out there. And for you guys, it's, you know, it's really important that you get patients who want to take part in what you're offering. It's a whole range of things, you know, and how people will benefit from that as well. Because in many ways, I think as Susie touched on, health isn't just about your physical health. A lot of it's to do with your, you know, how you feel about yourself and where your life is at any particular stage, and how we can give people opportunities to make the most of what they have and what they want to take part in. So, and that immediately can help folk in a range of ways, whether it's mental health or even physical health, getting people out and about or managing their pain better, or just giving people opportunities to improve their circumstances, which can help their health as well. So there's a whole range of reasons for doing this. Now that's, so there's a few points on the slide there about social prescribing and how it can really help. And obviously in general practice, we've got an awful lot of people coming to us just now with issues around anxiety and worries. You know, we've just been through a horrible year. Let's not be you know, have any, you know, illusions about that. It's been a horrible year, hasn't it, guys? It's a really horrible year. And it'll be nice to hopefully this year get back to some sort of normality, where we can start interacting with each other again physically and not just on Zoom. So social prescribing is really important. I think Susie also touched on how this fits in that wider health system. So we are trying to, in Keighley as ever, Keighley leading the way in so many ways. We are really keen to show the health system that this way of working with communities and health, collaborating really closely, and having positive outputs for the patients, positive outcomes for patients, can we get more system funding in to support organisations doing health work? So that is the ultimate aim here, is to get more sustainable funding. And I've just got to thank Susie and I'll thank GiveBradford for, you know, supporting us again in this second year, because in effect they're priming this way of working in the hope that we will get the health system to invest in it and make this more sustainable. So great vision from the funders to be supporting this work. And really, I'm really looking forward to everyone in the room getting their applications in and seeing what amazing projects we can have this year to build on the amazing projects that we had in the first year. So thanks for coming, guys, and really looking forward to you getting your applications in and see if we can get some resource to help you deliver and get you connected into the Keighley health picture through the social prescribers. So I hope that's nice and clear. But thanks for coming. Cheers.
Thank you, Bill. And thank you as well, Susie. So I'm going to speak a bit more about the criteria for this fund, and just go through the eligibility, and then we'll talk about the size of the grant and the application process. So who can apply for this fund? The fund is open to community groups, charities, social enterprises, community businesses, or any other organisations from the third sector. To be eligible, you will have to submit mandatory documents. So you must have a constitution or other relevant governance document. The governance document or constitution should include an asset lock or a dissolution clause. You must have a management committee or a board of directors or trustees of at least 3 unrelated people. You must have a bank account under the name of the group or the organisation with at least 2 unrelated signatories. If your organisation doesn't yet have a bank account, please do contact us and we can work around that. You must be supporting people in the Keighley and Airedale Community Partnership area. And you also, previous round from 2020, Kickstart grant recipients whose current spending and reporting is on track. And we understand with COVID and everything that's happened this past year, we've had to be quite flexible and we've been offering extensions. So if you'd like to apply for this fund, you would need to be on track for your current spending from that round and reporting. And also you must be able to demonstrate the added value of continued funding in terms of health and wellbeing outcomes and embedding the work that you've done within the local infrastructure. And you can apply for a development grant of up to 12 months. There's 15,000 maximum grant available there. If you are already a development grant recipient from last year's round, you won't be eligible to apply for another grant through this round. I'll just speak a little bit more about the exclusions as well, just to give a bit more context for this as well. So if, the fund again is open for community charities and third sector. We don't tend to fund for-profit organisations, but we can do, but you must have a clear asset lock in your governance documents. Groups that are unincorporated, so they're not registered on Companies House or with the Charities Commission, you won't be able to apply for a development grant, but you can apply for a Kickstart grant. If you have any questions about that, then please do feel free to contact us as well. So that's about who can apply and the eligibility for the fund. I'm going to speak a bit about the size of the grant. So there is 2 levels of this funding. Funding can support pilot projects and startup costs, can contribute to expanding or developing your current trading or enterprise activity. There are 2 application forms as well. So for Kickstart grants, the grant available is between £500 to £4,000, and it's for activities and projects for up to 1 year in duration. For organisations with an idea that supports people to meet people's health and wellbeing needs, but also who need support to develop their idea into a full business plan. So the Kickstart funding can be used to carry out research, can be to set up a pilot, or to do some feasible study or access expertise or consultancy, or any other activity that helps you develop your idea further into a sustainable community business model. So there for the Kickstart grants. For development grants, funds are available between 4,000 to 15,000 per year for up to 2 years. And this fund is available for services and activities that support people's health and well-being. If you apply for the development grant, we would expect you to have a clear plan showing how the development investment will support you to grow. The service must be capable of being delivered on a sustainable basis. Example, through being contracted to deliver services or individuals paying for the service directly through personal budgets or through self-funding. Development grant recipients will be required to access the networking and training opportunities that are available through this fund as a condition of the grant. These opportunities will be designed to help you engage with local NHS providers and to help build an infrastructure to support social prescribing in Keighley and Airedale. Previous Kickstart grant recipients can apply for a 1 year development grant if you, again, are on track to spend the funding from last year's round and to do the project reporting as well. So I'll move on to the application process. The full information and the criteria is available on our website, and we do advise that you please read the full fund criteria on the webpage before applying. If you do have any queries, you can contact us. We're still working from home, but we are still here by phone or email. Just to note as well, there are word count limits on some of the questions, and these are a maximum rather than a guideline. But please, we do ask that you press save as draft, which is just at the end of the document, so that you don't lose any work that you have done. And if you want to save your work before you finished, you can sort of go back in and sort of complete it and submit when you're ready. When you have completed your application, just press submit. You'll get an email saying that it's been received and it'll be processed. Again, you can discuss your project with us, and And if you want to check something before submitting, then please do feel free to contact us. Once your application has been submitted, we will acknowledge the receipt of the application. Your application will then move into the assessment phase, where it will be assessed against the criteria, and it will then be put to the decision panel, who will be able to make the decisions. If you are new to us, you may need to provide a reference, and that is a section in the application form as well, and that will be picked up during the assessment phase. And application forms, as mentioned before, there's 2 application forms, one for Kickstart and one for the development. Both have the same questions, but there's different word counts. So with a development grant, there's a little bit more information that you'll need to include. There is a guidance document available at the start of the form, which gives further information about what we are seeking and what we're expecting from each question. Questions are designed to, I guess, ask you about your organisation's aims and sustainability plans, as well as the people that you support, what the project will involve and achieve, and then how you will link in with NHS and other healthcare providers. And it'll give you a chance to put a budget breakdown as well, so we can see how the grant has been spent. Just to note, I always would say just to refer back to the criteria, and always just make sure that everything is ticked off. We are looking for that social prescribing element there as well. And we do ask as well that you can please be specific about what you would like to do with the grant, who you want to support, what needs and addresses you would like to, what needs and issues you would like to address, and just to be very clear and specific in your application. You'll also need to upload some supporting documents, please. Your governance document, your most recent set of accounts, a list of board committee members. The fund can support capital items over £500, but we would need to see quotes from suppliers. And development grants, we would need to see a business plan as well. Just a bit more about the budget as well. You can include things for overheads as well, or I guess the hidden costs relating to your project. So that can be things like volunteer expenses, DBS checks, travel costs, rent, things like that. So please don't feel afraid to put those in your budget. And we also can accept in the budget evaluation costs as well. So that can be either staff time in terms of resource, or if you want to get an external evaluator to come in and do the work, that's fine as well to include that within the budget. And speaking of evaluation, for this fund, again, it's really about having that network of social prescribing for Keighley, but also being a really good positive example for other areas in the country. So the evaluation process, we want to really build on the evidence for this programme's impact. So there will be reporting on impact of your grant, and that will be done in an end of grant report or an interim report if your project is for 2 years. And we also commission external evaluation too. And with the evaluation process for this fund, we want to see impact of investment on use of local services, process of grants to small local organisations, process of close working between GP practices, funders and organisations. And we want to make the case for a greater shift of investment to community-led and community organisations and community business for social prescribing. There is a wider piece of evaluation work being done for this fund as well, and that's being completed by MEL Research, and they are looking at the wider impact and outcomes of this programme. So there may be requests when you are funded to maybe do interviews, offer a bit more data and information. And there'll be further information about that at a later date. So the evaluation, we are really keen to understand again the impact as a result of the grant being made. We do want to see sustainable social prescribing activities and groups. So all organisations will be expected to complete the end of grant report, which captures information on what you have achieved, what you have learned, what the outcomes have been, and again, in some cases, an interim report may be required. So if your project is being delivered over 2 years, the grant payment will be split in half, with the final payment due on submission of a satisfactory interim report. We ask that you think about learning, how that will be evidenced and demonstrated, consider the project's planned outcomes, the success measures, and how the outcomes and impacts will be captured. Again, you can include evaluation costs within your project budget in the application form. There's different tools that you can use for evaluation. It's good to think about that now with this application before you submit. So you may wish to capture the project's impact through tools such as qualitative case studies or quantitative pre and post questionnaires for beneficiaries. Case studies, we always like to see the impact of this funding as an individual as well, for individual beneficiaries. You can gather quotes, feedback from the people and beneficiaries that you support, photographs, video links. We just ask that you please ensure that you have the appropriate permission before that you share that information with us. And it is good to really think about, your project and how you will measure that success, and what your performance measures are, how you will capture the impact at this application stage. With the timeline for this fund, just to go a bit more into give you some dates. So the deadline to submit your application is Wednesday the 19th of May at 12 noon. And application assessments will then be completed in June. And decisions will be sent by email in early July. Once you've received, if you are successful and you've received an offer from us, the grant payment will then be made within the next few weeks. There's a 6-week window to accept the grant offer. If you have applied for a 2-year project funding for development grants, then the grant will be split in half to equally yearly instalments. So the first payment will be paid between July and August of this year, and then the second and the final interim payment will be made in August 2022. And that is on the receipt of the interim report as well. So that's the application process, and just to give you an overview of what you need to do to apply. I'm going to open, we've got a good 20 minutes, so I'm just going to open now for Q&A. If you have any questions that you'd like to ask me, Bill, or Susie, then please do feel free to jump in now and we can answer those questions. Or if you'd like, you can pop your question in the chat and we can pick that up as well.
Good morning. I'm West area. Is the fund open for projects that have already started but will support further development of a particular project? Anyone?
Yes. Yeah, you can support as long as it meets the criteria of supporting health and well-being for beneficiaries in Keighley, and it's still got that social prescribing element there. And you just want to expand on, if you know it works and you want to expand and grow that, then that's fine. You can include capacity building within the budget as well.
Thank you.
Thank you.
Hi. It's
Hello.
Naz Kazmi. Hi. Susie. It's Naz Kazmi from Keighley Association for Women and Children's Centre. If we've already received the funding and you just want to continue with the work that you've already done for the last year, would that be possible, or does it have to be a new project altogether?
If it's a Kickstart grant that you received last year, we would be looking to see development of that. So the Kickstart grants were designed to, I guess, turn an idea into a sort of model for social prescribing. We would want to see a build up on that if you apply for the development grant. So there is a business plan that needs to be submitted with the application. So, I mean, again, if you know something does work and you want to expand on that, then that's fine. But if you're moving from Kickstart to development grant, then we do want to see that journey and that build it on the original idea.
Can I just ask what you said there, Helena, you know, about the business plan, because we got the Kickstart grant last year, and it's been absolutely fantastic, and we've just gone through the process of changing to a community interest company. So I'm just very much at the start of doing that business planning, and I've been listed to somebody to kind of like help me so that I can do it all properly and things. If we're not quite there with the business plan complete, but I can show that we're on track to do it and I'm getting that support, is that still okay to be able to do that?
Yeah, that's fine. Yeah. And as part of your development proposal, if you want to sort of put more consultations, or if you just again want to build on that work, you can include that in the application. That's fine as well.
Perfect, thank you.
Thank you, Emma. There's a question here in the chat. Is there a maximum turnover for eligible organisations, please? Sorry, I can't turn on my microphone. Oh, don't worry, I understand. I've got a little cat here as well, and she keeps meowing in the background. But for this fund, no, there isn't any income maximum turnovers for this fund. No.
Just a question, could the fund be used to employ a centre manager? Because at the moment our centre is run purely and simply on volunteers, and we've got 2 or 3 projects that will fit into your criteria, which I'll talk to Bill about, and we are using already social prescribers in one of the projects, but we don't have anyone that actually is in the centre, or as I say, all volunteers. So if we wanted to say employ someone for 20 hours to work on these particular projects, to facilitate them all together, would the project be able to fund something like that, or part of?
Yes, you would be able to put salary costs in the budget for a project lead or a program coordinator, whichever the title is for this person, as long as the funding is used sort of in relevance to the social prescribing activities that your centre does, then that's fine, perfectly fine.
We've just launched last week the first digital community health hub, working with Modality and Keighley Healthy Living. So it's to now start expanding on that. We're aiming to do every Thursday, 1 while 3. So we want to expand on that and include extra things. So this certainly I know we will fit the criteria, but there's room for expansion. So if we can get funding from yourselves for that type of thing, then I know we can grow further. So thank you, Helena. Thank
you, absolutely. And it's really, I think this fund is really good because it does have that sustainability. We are hoping to support, you guys to be here in the long run and to really provide these services and provisions for local people. So thank you so much for attending today, and sounds really good, positive.
Helena, I think Gemma Hobbs, have you got a question, Gemma?
Oh, hi, yeah, I just wanted to ask. So we were one of the Kickstarter grants, so we could apply for up to a year for up to 15,000. The main thing for me is about that sustainability beyond it. So are we all right to sort of write into it a bit of time to really look at that and think about the ways we could become sustainable in terms of bringing funds into the project from service users and other avenues? Is that all right?
Yes, that's fine as well. And there is a question in the application form about sustainability. And we understand that sometimes, you know, you may be grant reliant, for example, or you may be a social enterprise, so maybe there's goods or services that you're providing. There's different ways of bringing in that revenue and income. And if you want to explore that further within the development grant and the proposal, then we do welcome that.
Okay, that's fab. Thank you.
Thank you, Gemma.
Can I ask a question?
Sure.
Kind of trying to get my head around whether it's the Kickstarter or the development grant that we would be best placed to go for. I won't go into too much detail, but basically we're running a number of programs to support mental health, and there is a social prescribing element through Simon Booth and others. I noticed Simon's just left the meeting. So we've kind of got existing programs that we would like to expand on, but then we've also got lots of other ideas. So it's almost like the programs we've already been running would be in that development space, if that makes sense. But these kind of new ideas might be in that Kickstarter space. So whether we can, for example, apply for a development grant that includes both expanding existing work and starting off new work. It's kind of in that balance.
Yeah, sort of just in between. I think you can apply for the development grant if, I guess for the Kickstart grant, it's really for groups that have an idea, but they're just really not sure how to get it off the ground and how to really you know, sort of implement that as a service and as a provision in Keighley. But if you're already doing that and you're already aware of all the logistics that you need to do, then maybe development grant might be the best option for you. Again, you can apply for between 4,000 and 15,000. So you might not want to go to the top end. You might want to go in the middle or near the £4,000 mark. That's up to you. But yeah, I think if you do have an idea and you just want the development grant to develop it further, then that's fine. I think the Kickstart is more for, I guess, smaller community groups and you know, sort of involuntary community associations that just have an idea but just need that extra bit of support to be in a community business or a charity.
Yeah, that's helpful. Thanks.
Thank you. Is there any other questions? It's nice to see everyone's faces as well, can I just say? It's just like really nice. The sun's shining on everyone. It's good. Okay, I think, again, if you do have any questions that you may not want to raise in this event, please, you know, do email us and then we'll be able to discuss that with you. This will be available on our website and on our social media as well if you want to refer back. Again, the criteria is available on our website. And yeah, I just want to say thank you to everybody for coming today. Really appreciate you taking the time. And we really appreciate the interest and the enthusiasm that you're showing for this fund. We're really proud of the work that you've all done so far, especially through this really difficult period that we've had the past year. And we do see the work that you're doing and we really admire and respect that. So yeah, just a massive thank you to everybody. Thank you.
Hi, Helena. Yeah, I just wanted, and just I remember we did this event last year at Central Hall, and there was obviously a lot of conversations and connections were made afterwards. And it's probably the thing that we miss at the moment when we do everything on Zoom. So, you know, rest assured, as soon as we can, we will be organising some community get together to try and get a bit of that good networking going on, because that's the bit I think we do miss in the Zoom calls a little bit, that, you know, being able to physically talk and mix with each other. So again, I'll just say, you know, the social prescribers were in the call today. Hopefully some good connections have been made there, and you know, let's keep talking. You can email Community Foundation for any advice or guidance. You can get in touch with me as well, and I'm always keen to lend a hand or talk about how we can connect, and get in touch with the social prescribers because they can maybe help support the bid is, you know, saying, you know, we're happy, you know, by saying, you know, this is a good thing, we've got patients who need this type of thing. It's all good evidence to put in your bids, guys. So yeah, but as Helena says, and thanks to Helena, thanks to Susie, you know, it's a really, you know, to be doing something like this in such a targeted area like Airedale and Keighley is really, really positive and a terrific turnout. So thanks all for coming, definitely. Yeah, thanks, Helena. I just wanted to get that connection thing in there, just so we could all be thinking about that, because we do miss that. And a cup of tea and a sandwich. I miss that as well. Probably have too many sandwiches, but that's another story.
Yeah, I think it'll be good, like something to look forward to when we can really come together and, you know, celebrate and share ideas and look at the work that we've all done together. Definitely. Thanks, Bill. On that note, I will say goodbye. Thank you, everybody.
Thanks, everyone.